is estimated by McKinsey and the World Economic Forum that the impact of non-communicable disease in the next 15 to 20 years on India will be $5 trillion. We are the diabetic capital of the world. We are the heart disease capital of the world. We're the cancer capital of the world. So in a decade from now, a doctor will come home, he'll carry a small tool, he'll do a complete head-to-body analysis. The diagnostic center came home. He'll touch a button and the AI will process what you have, your results, what your predictive risk score, what your diagnosis according to multiple other specialists, collated, and then he will sit down with you and begin to communicate it in a way that you understand and you respond and you continue your journey to health. That is the future of healthcare. But good afternoon, ladies and gentlemen. It's a pleasure to be here, and congratulations, Lakshmi, and this wonderful band of people whose passion shows even in a short conversation. It's a great pleasure. I reflect something that Vishal said, that I believe that health is our most valuable asset and hence should be treated so. But you know something? Public memory is so short. How many people died of COVID? 6,914,413 as of today. And what does the newspaper talk about? We're talking GDP, we're talking G20, we're talking about relationship between two countries and who's fighting with who. And then we go into politics or cricket or movies. Health, which was one of the biggest subjects on everybody's mind, has once again been forgotten. We need to reiterate the fact that we knew that morbidity and mortality was higher in the people who had other comorbidities. We understood that those who had a precondition succumbed more to COVID. We realized that a public health infrastructure or a preventive care infrastructure made the difference between life and death. And so many other learnings happened in those 3.5 years. And yet today we've gone back to the life the way it was almost. And therefore, I have made it my life's passion to make the world realize that it is not property, it is not assets, but health, which is really our most valuable thing. And then, because of that, I want to bring this new dimension to what are the building blocks of health. We always speak about, beds. We need more beds, and as someone who, along with my father and the entire team, we've dedicated 40 years of our life to building beds. And India still has a 0.5 to 1,000 bed ratio. We need 3 million more beds by 2030. We need more beds. But yet, there are other things equally important. Because in the paradigm of healthcare, one of the most important aspects is proactive preventive healthcare. Because it is estimated by McKinsey and the World Economic Forum that the impact of non-communicable disease in the next 15 to 20 years on India will be $5 trillion. It's 4.79 something, but we made it 5 because all of you know that we're seeking to become a $5 trillion economy. We'll use up our economy in the treatment of healthcare unless we do something about proactive preventive healthcare. With 100 million diabetics and 3 other very, very critical gold medals. We are the diabetic capital of the world. We are the heart disease capital of the world. We're the cancer capital of the world. None of these are gold medals that we want. We need to do something about it. And that something begins not with the government, not with hospitals to build more beds, not with polluting societies who also need to get better and clean up their act, but it begins with the individual. And it's about lifestyle improvement. It's about being overweight. It's about mental health. There is so much that we need to do, and that research and data have shown how we can and what we can need to do. But it is not all a grim picture. I must begin by saying India has made tremendous strides. Whether it's our 4x improvement in infant mortality or our 7x improvement in maternal mortality and our 30% growth in the average lifespan. And cutting-edge technologies and infrastructure have made India the health capital of the world for medical value travel because we are capable of delivering the best outcomes at 1/10 of the price. Let me tell you the story of Mahendra, a rare neurological disorder called nemaline rod, spent 9 years of his life looking at the world upside down. A complex surgery between orthopedics, neurosciences, internal medicine, and multiple other specialties. He now sees the world the right way. This is Mahendra. Moving on to talk about this really cute little child who was the first one in India to be treated of a brain disorder using proton. India has the technology that the rest of the world is using to treat young children with complex brain disorders. But this is one of the most touching stories. This is Adriana and Abriana, conjoined twins from Tanzania. By God's grace, with over 72 doctors, multiple clinical teams designing, planning, and programming, they went home one day before Christmas to their home in Tanzania to be received by the entire family. It is stories like these which are reflective of the Indian capability of what we can do and what we can do for our own. This is young Sanjay who came to us when he was 2 years old with advanced liver disease and without the funding that he needed to go abroad to have this treatment, very much the reason that Apollo began. This is Sanjay after the country's first liver transplant. He was 2.5 years old. This is Sanjay at 4, at 10, and at 15 years later, when the government released a stamp commemorating India's first liver transplant. Today, we're among the world leaders. And the story gets better. I wanted Sanjay to be here with all of you. Today, he's a doctor practicing at Apollo Hospitals, Bangalore. So these are the reasons that I have this tremendous passion for healthcare. How do we grow it? How do we improve it? How do we spread it? But as we're building advanced cures, in the very same breath, there's a new threat and a new challenge. And this challenge is something that we can face head on. But it is $4.8 trillion, the NCD burden. And currently, we moved from being a country where we had death due to infectious disease and old age. 60% of all deaths are due to non-communicable disease. Vishal was telling you about it, cardiovascular problems, the heart attacks that our young friends over there quickly told us. It's cancer, it's strokes, but all these are fueled because of obesity, of poor lifestyle, of hypercholesterolemia, of course of genetic makeup. And India has a higher propensity to cardiac ailments, but we can do so much about it. And that's what I wanted our focus to be on, in how are we going to change the focus of healthcare to become a community program? And how are we going to use technology to make this a reality? So I want to share with you just one or two of the many things that are happening in this country and that we are doing. This is a super busy slide, but it's an important one. How many of you have done, what lots of newspapers say, do a health checkup for 750 rupees, for 999, for 299, and you do a battery of tests? I just want to tell you that a battery of tests is not a health checkup. So when you look, a current good health checkup begins with an AI-enabled, personalized health risk assessment score. Because if you don't have a history of liver disease, if you don't drink, and you're living a good and healthy lifestyle, you don't need to do so many of those lab tests. You need to look at something else. So this personalized health risk assessment throws out a personalized menu of the tests that you need. And from the reports of that, you then create an AI-enabled predictive risk scoring. Are you more susceptible to cancer? Does your genetic profile say that you may get Parkinson's early, and therefore what can you do to prevent it? And then a guided path to wellness that you can follow, guided by your PHR, which is available on your phone, with nudges and reminders and tracking. So the world of healthcare is changing, and it's moved from the hospital to the clinic, from the clinic to the home, and from the home to a 24/7 ubiquitous access to care enabled by your mobile phone. So we need to adopt and take power and responsibility of our health. And that, I think, ladies and gentlemen, is one of my most important messages for today. But moving on, much of this begins in how you do it, and the physician needs to heal themselves. So about 2 years ago, our chairman said our entire organization needs to have a health checkup. And when we looked at it, the health community itself is not so healthy. But I want to share with you not the fact that we had 48,000 people who did the checkup, or 28% of them have NCDs, but look at the color graphs. While the incidence of disease in the 40 to 60-year age group came down, or the obesity came down, their cardiac ailments and their diabetes went up. We sowed the seeds of that ill health when we were 30. So please, those of you who are at 30 years old and thinking, okay, I'll look at this a few years later or next decade, please believe me that what you're doing today is going to impact your health 1 decade and 2 decades down. The point of time to begin to look after your health, to do your checkup, to make your proactive doctor your friend, that point of time is now. I want to move on to say that so much in technology has enabled the transformation which is happening. And almost 3 decades ago, I attended a lecture in Seattle. And those of you who hear Seattle will think this is Microsoft, this is Bill Gates. But I actually heard from Bill Gates' Kabab. Senior Mr. Gates said that the world of healthcare is being transformed by 3 Bs. And that still remains valid. And those 3 Bs are the biology, your genome, what your DNA expression is. Bytes, which is the processing capacity. Because our CT scans, who are now doing CT scan, which is doing a heart scan so you don't have to have an angio, the processing capacity has gone from 60 slice to 120 slice to 640 slice. The processing capacity is enhancing our insights into healthcare. And finally, it's bandwidth, so that the care that you have in Bangalore city can happen in rural India, so that the care that we have in India can happen in Uzbekistan and Africa. This connectivity of telemedicine is a journey that we are following, which is transforming lives. And then we go beyond to say it's not just a doctor speaking, but the Internet of Things, the cloud, and the ability to do remote care is truly transforming healthcare. And it is in this environment that I request all of you to begin by taking care of yourselves, to enhance and embrace the process and the progress of technology, whether it is federated learning systems, whether it is sharing data, whether it is understanding what is happening in the healthcare world and adopting AI models. But beyond that, I think what we're looking at is the final truth. And this is something that my father, and I'm very proud of, having had the privilege of carrying on, working side by side and carrying on his journey of bringing healthcare to people. But my father told a group of doctors, senior people at a conference, and these were senior cardiologists, very, very eminent oncologists, gifted robotic surgeons, and he told them, everything that you do, please remember one thing. Whether you're using AI or the fanciest machine, or you put your patient on proton, remember that the journey from your very intelligent brain to your super skillful hand, that journey goes through your heart. So everything that we're doing is about the patient, is about the relationship, and is about finding a way for people to feel that empathy. So in a decade from now, or you can imagine, Bangalore city may have it faster. You may use a Uber-like app. A doctor will come home, and you will say, even my grandmother's time, doctors came home, but this doctor will be different. He'll carry a small tool. He'll do a complete head-to-body analysis. The diagnostic center came home. He'll touch a button, and the AI will process what you have your results, what your predictive risk score, what your diagnosis according to multiple other specialists, collated, and then he will sit down with you and begin to communicate it in a way that you understand and you respond and you continue your journey to health. That is the future of healthcare. That's where technology and humanity, the power and the vision to use this technology, but the passion and the commitment to make it work for people in cities, in rural India, across the world. And India can become that sandbox of innovation, using biodesign that you're going to hear about, using all the other tools, because we need to reach 1.3 billion people. So why can't we dream and design for 7 billion people? That's what India can become to healthcare. So we will heal in India, we will heal by India, and we can heal from India. This is something that I truly, passionately believe in. I think we're doing it now from the Himalayas to different parts, but this will become more pervasive. It'll be platforms. This, incidentally, is a screening program and a tele-emergency center on the foothills of the Himalayas, where 3 months of the year you can't even reach a car. So if somebody gets super sick, we have to call for a helicopter from the army. But we went there and did this screening program. So these are the type of things, but all these dots are connecting. Using the UID, using the PHR, using public digital goods, all these are connecting. And at the back end of them, the new AI algorithms that we can put forward will help to bring a universalization of the knowledge available in healthcare. And that will be the transformative period when we can bring health access to everybody. So thank you, everyone. May I request you to please seize the moment. Seize the opportunity that technology and innovation and bioelectricals and biosciences and all the new cures. Seize the opportunity to dream of health equity, where the whole world can be healthy and happy. Thank you.